If you're over 60, there's a good chance you felt this before. You're not eating more than you used to. You're not eating junk or anything extreme. But after a meal, your body feels heavier, more bloated, and sometimes that tired feeling sticks with you well into the afternoon. I've had patients say to me in the clinic, genuinely confused, "Doctor, I eat fruit because it's supposed to be healthy. So why do I feel uncomfortable afterward?" That question is very real. And it's not just about fruit, it's really about the quiet changes that happen inside your body after 60. At this stage of life, digestion isn't as fast as it used to be. Your body handles sugar more slowly. Low-grade inflammation tends to linger longer. And most importantly, your body doesn't tolerate things the way it did when you were younger. Because of that, many people start to feel lost. They don't know what to eat. They don't know what to avoid. And little by little, they start to feel anxious about eating at all. My name is Dr. David Warren. I'm 60 years old, and for more than 30 years, I've sat across from thousands of older patients who aren't looking for miracles. They just want to eat in a way that doesn't make their bodies feel worse. Today we're going to talk about pineapple, a familiar fruit, sweet, fresh, sounds very healthy. But after 60, pineapple is no longer a simple story of good or bad. Used the right way, it can gently support digestion, joint comfort, and immunity. Used the wrong way, it can cause discomfort, raise blood sugar, or irritate the stomach. This video isn't here to convince you that you should eat pineapple. My goal is simply to help you understand your body better, so every food choice feels calmer, more controlled, and less frightening. And now let's start with the most important point. Point 1. After 60, the issue isn't the pineapple, it's how your body receives it. When you were younger, your body produced digestive enzymes easily. Your stomach acid was strong, your intestines moved smoothly, your liver processed sugar quickly. After 60, all of these processes slow down, not because you're weak, but because this is normal biology. What that means is this: a food that felt fine years ago can now place more stress on your digestive system. When you understand this, you start to stop blaming yourself for feeling uncomfortable after eating. Stop blindly following advice like, "This food is good for you." Start paying attention to how much you eat, when you eat, and how your body responds. And that's the first step toward eating more gently after 60. Before asking, "Is pineapple good for me?" ask, "When am I eating it? How much am I eating? What am I eating it with?" After 60, the context of eating matters more than the food itself. In my clinic, I often tell patients, don't ask whether your body accepts this fruit. Ask how hard you're asking your body to work. When you reduce the burden on your body, many problems begin to settle on their own. Point 2. Pineapple and digestion after 60. When outside enzymes help the body breathe a little easier, one of the least talked about changes after 60 is this. Your body produces fewer digestive enzymes than before. This especially affects the digestion of protein, meat, fish, eggs, meals with many components. When enzymes are low, food stays in the stomach longer, produces more gas, causes bloating, chest pressure, and discomfort after meals. Pineapple contains natural enzymes that help break down food, especially protein. It doesn't replace your body's enzymes, but it can reduce the workload on a slowing digestive system. When used properly, many older adults notice that stuck feeling after meals goes away. The belly feels lighter with less bloating. They no longer feel completely drained after eating. What's interesting is this: when digestion improves, mental energy often improves too. Instead of wanting to lie down, you feel more able to stand up, move around, and continue your day. And for older adults, that matters. Eating should never be something that makes you afraid. If you want to use pineapple to support digestion after 60, keep portions small, about half a cup of fresh pineapple. Eat it after a meal, not on an empty stomach. Eat slowly and chew well. Don't use pineapple as a quick fix for bloating. Don't pair it with very heavy, greasy meals. The goal isn't a strong sensation. It's gentle, lasting comfort. I often tell my older patients, if you feel lighter and more comfortable after eating, your body is saying yes. If you feel burning or irritation, You didn't do anything wrong. The portion was just too much. After 60, eating less but eating right is always better than forcing more. Point 3. Quiet inflammation after 60. Why some people feel their joints ease when pineapple is used wisely. After 60, many people live with what medicine calls chronic low-grade inflammation. It doesn't flare dramatically, no fever, no major swelling, but it quietly settles into knees, hands, lower back, neck and shoulders. You notice it when you wake up stiff in the morning. You need a moment before standing up. Your joints take time to wake up. Pineapple contains natural compounds that help calm inflammatory signals, not by numbing pain, but by reducing long-term inflammatory activity in the tissues. That difference matters. When used in the right amount, people often tell me, mornings feel less stiff. My joints don't creak as much. Movement feels smoother. This doesn't happen overnight. It happens slowly but steadily. And emotionally, the biggest benefit isn't being pain-free. It's the feeling that your body is still working with you. When you can still walk, do household tasks, live normally, your mind feels lighter too. If your goal is joint support, choose fresh pineapple. Keep portions small, no more than half a cup. Use it 2 to 3 times per week, not daily. Don't replace prescribed medication. Don't eat it on an empty stomach. Don't increase the amount just because it seems okay. Inflammation builds slowly. Supporting it must also be slow and steady. I always tell my patients, if you're looking for a cure for joint disease, pineapple isn't the answer. But if you want your joints to feel less irritated day to day, eating it the right way can help. After 60, what matters most isn't eliminating all pain. It's making sure pain no longer controls your life. Nuban mon, toi ko the tiep tuk dich kak fan tiep theo, ibonjen bai, Gyu Jungjeong, American Conversational, Chuan YouTube voiceover. Doi jai la bandage sang tieng an. Von noi tun hien deo gyong mai. Fu hupche juk voiceover YouTube chokan gialon toi. Toi gyun hip noi cham, vading he. Point 4. Heart health after 60. Why eating pineapple the right way can ease the load on your heart. After 60, your heart may still be strong, but your blood vessels become less flexible over time. The vessel walls gradually stiffen. Blood doesn't flow as smoothly as it once did, and that slowly increases the workload on your heart. Pineapple provides minerals that help support fluid balance and blood pressure, antioxidants that reduce oxidative stress inside blood vessels, natural compounds that help calm low-grade inflammation in the circulatory system. None of this cures heart disease. But when used properly, it can help the heart work a little more easily. In some older adults, when pineapple is eaten in a balanced way, I often see less heaviness or pressure in the chest after meals, less shortness of breath when walking, less end-of-day fatigue. These changes are subtle, but after 60, subtle changes matter. Because heart health doesn't improve through big dramatic moves. It improves through small, kind choices repeated every day. If you care about your heart, use pineapple as a small part of a balanced meal. Pair it with protein vegetables, healthy fats. Don't use pineapple as a detox. Don't eat it on an empty stomach. Don't replace heart or blood pressure medication. Pineapple is a companion, not the one driving the car. I often remind my patients, after 60, your heart doesn't need you to do impressive things. It just needs you to stop making its job harder. If a way of eating makes you feel lighter overall, your heart is benefiting too. Point 5. Blood sugar after 60. Pineapple isn't forbidden, but it must be eaten wisely. After 60, your body handles sugar more slowly than before. Insulin works less efficiently. Muscle mass, where sugar is burned, gradually declines, and the liver releases sugar into the bloodstream more easily. So even without eating very sweet foods, blood sugar can rise quickly if you eat on an empty stomach, eat large portions, eat carbohydrates alone without protein or fiber. Pineapple is a natural fruit. But after 60, natural doesn't mean unlimited. When pineapple is eaten correctly, many older adults notice less lightheadedness after meals, less sudden sleepiness, more stable blood sugar readings after eating. More importantly, they stop being afraid of fruit. And that fear, if it lasts too long, often leads to restrictive eating and nutrient deficiencies. If blood sugar is a concern for you, a safe amount is usually about half a cup of fresh pineapple. Eat it after a main meal, not on its own. Pair it with protein, fish, eggs, plain yogurt, fiber, vegetables, nuts, seeds. Don't eat pineapple for a quick energy boost. Don't eat it every day. Don't change medications without medical guidance. Pineapple itself isn't harming you. How you eat it determines how your body responds. I often tell patients with diabetes or prediabetes, after 60, control doesn't mean restriction. It means understanding how your body reacts to each choice. When you eat with understanding, meals become a source of comfort again, not fear. Point 6. Immunity and recovery after 60. Pineapple can support, but it can't carry the whole load. After 60, your immune system doesn't disappear, but it responds more slowly. Recovery takes longer. Fatigue lingers after even mild illness. You may notice this when small cuts take longer to heal, colds last longer than they used to. You feel noticeably weaker after getting sick. Pineapple provides micronutrients that support immune cells and tissue repair. It doesn't make you immune, but it can help prevent your energy from dropping too quickly when your body needs support. In some older adults, when pineapple is used appropriately, I see less exhaustion after mild illness, faster return to normal daily routines, less anxiety when the weather changes, and most importantly, confidence in the body starts to return. When you believe your body can still recover, you stop living in constant fear and defense. If your goal is immune support, use pineapple as a small part of a varied diet. Combine it with adequate sleep, proper hydration, gentle daily movement. Don't use pineapple as an instant immunity booster. Don't skip vaccines, medications, or medical advice. Don't eat it during active stomach irritation or mouth sensitivity. Immunity doesn't get stronger from one food. It gets stronger from many small habits practiced consistently. I often tell my patients, after 60, your body doesn't need you to push it harder. It just needs you not to let it go unsupported. If pineapple suits you, it can be one small piece of that support. Point 7. When pineapple becomes too strong after 60, and why that's not your fault. After 60, the lining of the stomach, mouth, and intestines becomes more sensitive, not because of disease, but because the body's natural protective layers thin over time. Pineapple is a fruit that is acidic, contains highly active enzymes. For younger bodies, this is usually not a problem, but for a body that has lived many decades, strong can sometimes mean too much. Some people may experience mouth or tongue irritation, burning in the upper stomach, heartburn or reflux, loose stools, or cramping. What's important to understand is this. This does not mean you can't eat healthy foods. It simply means your body is asking for gentler care. When older adults understand this, they stop forcing themselves to eat foods labeled as healthy, feel less disappointed in themselves, learn to stop at the right time instead of pushing through discomfort, and that leads to a calmer stomach, better sleep, a much more relaxed state of mind. Eating after 60 isn't about proving anything. It's about living more comfortably each day. If pineapple has caused discomfort for you, try only a very small amount. Always eat it after a meal. Eat slowly and observe how your body feels over the next few hours. Don't eat it on an empty stomach. Don't eat it many days in a row. Don't try to train your body to tolerate it. And if even a small amount still causes discomfort, stop. Your body is communicating very clearly. I always tell my patients, after 60, listening to your body is not weakness, it's wisdom. No food is mandatory. Only choices that are appropriate or not are for you. Final thoughts. Before we finish, I want you to remember one important thing. After 60, health is no longer about eating the right superfood. It's about how you treat your body. Pineapple, like many foods, can support digestion, can calm low-grade inflammation, can help the body feel lighter, but only when used correctly. Today we covered the key points. The body after 60 processes food more slowly and sensitively. Pineapple can help, but it's not for everyone and not for every situation. Small portions, eaten after meals, not too often, while listening to your body. And most importantly, don't force yourself just because someone says this is healthy. I've seen many older adults grow healthier, not by eating more, but by eating more wisely and more gently. If there's one piece of advice I want to leave you with, it's this. After 60, don't ask, what should I eat to be right? Ask, what helps my body feel better today? When you start asking that question, you're already on the right path. If this video helped you understand your body more clearly, please subscribe and continue this journey with me. Here we don't chase trends. We share calm, science-based guidance that respects the aging body. And before you go, I'd love to hear from you. Where are you watching from today? Just leave your city or country in the comments. Let's remind each other that no one ages alone. And finally, a clear and responsible reminder. This video is for educational purposes only and does not replace personal medical advice. Take care of your body with patience and kindness. It has carried you through an entire lifetime.